Switching from assist control to an SIMV is a common practice. We set up pressure support and leave all other settings unchanged. Now that is the wrong thing to do. Remember, in SIMV, the set respiratory rate should be kept low, 8 to 10 breaths per minute, because in SIMV, respiratory rate that we are setting is actually defining the number of controlled mandatory breaths that the machine will give. But in SIMV, we are trying to allow the spontaneous breaths of the patient to happen. We want the patient to breathe spontaneously. Because we want these spontaneous breaths to happen and assess them, we don't want these spontaneous breaths to merge with the control breaths and create an asynchrony. Because if these partially supported spontaneous breaths merge with the control breaths, patient's expiration might coincide with the inspiration due to a machine-generated breath and create asynchrony. Hence, these control breaths needs to be wide apart and give adequate space so that these partially supported spontaneous breaths can happen properly without asynchrony. So this should be the main perspective when we put a patient in an SIMV mode from assist control, where we are trying to assess the spontaneous breathing effort of the patient in the backdrop of a safety ventilation provided by the set controlled mandatory breaths in an SIMV.